Good morning. We're here today talking about the Breast Care Boutique, and I have Stephanie here and Karen. How are you?
Fine.
Doing well.
Good, good. Why don't you tell the viewers out there what is so special about this boutique?
The Home Medical Equipment 2000 Breast Care Boutique is special because we're passionately committed. We're passionately committed to helping ladies find special products that they need after they've had breast care surgery, or mean more or less a post-mastectomy, or if they're the hard-to-fit ladies. One of the things that we know about ladies who have been diagnosed with breast cancer, the last 10, 15 years, they've made a lot of advances in the care of and services for breast cancer patients. So one of the things that's unique about our boutique is that we carry a variety of different products, accessories, prosthesis, and we carry a lot of the items that they need for after surgery. And one of the things that's unique with us is we do the one-on-one complimentary private fittings, and that serves our after breast surgery patients as well, and then it also serves the lady who is hard to fit. In the United States, there's a saying that most women are wearing the wrong bra sizes, but we have a group of professional fitters that also included in that group are clinicians. We have a licensed practical nurse, a nurse practitioner that also helps to fit our ladies, and we want to let the community know that when they say yes to coming into our doors at the Breast Care Boutique, we're able to be available to them because all of the array of products that we have.
And that's another thing. Why don't we talk about some of the products?
I'll let Karen do that. Karen.
Okay, awesome.
Our products are from Anita, Amona, American Breast Care companies. They include the bras, the breast forms, camisoles for medical and leisure use. We also have active wear like swimsuits, the special active breast form that wicks away the moisture from the skin. We also have the sports bras, and we have lymphedema sleeves that are through the Lymphedema Sleeve Company and Job's Company.
Now, we don't have a lot of time left, but why don't you tell the viewers out there, why is it important to use this if you do have a prosthesis?
It's important to have a breast prosthesis to help keep your posture balanced, to protect your chest and surgical score, to keep your bra from shifting, and to also prevent problems such as spinal curvature, shoulder drop, and muscle pain in the back and neck.
Okay, and there are some payer sources, real quickly. Why don't you tell the viewers about those?
Of course, we accept private pay, and we accept Medicare, Medicaid, and most commercial insurances.
Okay, so basically, how do they get started? They come in, tell the viewers where you are and how to reach you.
We are located at 2013 Oak Park Boulevard. Our number is 480-0045.
Call the Breast Care Boutique today. We're here today with Home Health Care 2000. I'm Anne Marie, and we are here today with Dr. Wayne Campbell. How are you?
Great, how are you?
Great, great. Now, why don't you tell the viewers out there about the progress of the physical therapy that you guys have in the program?
Well, our actual therapy program, we have incorporated in-home therapy teams around all of our locations, and that's 12 rehab branches around Louisiana.
Wow.
So what we're focusing on is helping the geriatric population and many others improve from injuries such as ambulation, walking better, things like safety in the homes. As you know, the geriatric population, they're prevalent to falls. So that's one area that we're focusing on lately with our balancing program that we're incorporating. Other conditions such as orthopedic injuries, a lot of people have surgeries, knee surgeries, shoulder surgeries, those type of things. So we cover a diverse area. So we're able to help a wide variety of people, and safety in the home is a real big thing.
Absolutely. Now, what is your future vision for this program?
Well, I would hope for the therapy program to evolve to where anytime a doctor such as an orthopedic case comes in, surgeons, we can help them at all times improve the patients. That's the number one thing for us. We really stress safety in the homes. So we want them to be safe as possible in the home, but also not just safe, as independent as possible. So we have many things such as in the homes, bathing, dressing. We can help with all those type of things. Speech therapy, physical therapy, occupational therapy. Our therapy team is here to serve the public.
That's great. And how does that, the overall population, how does that help?
Well, take for instance, if you have a surgery in your shoulder, you need rehab. So shoulder surgery, you want to get back to doing things you could do. Maybe you couldn't bathe as well. Maybe you can't do things like you used to do, reaching up in your cabinets. So those type of things. With the therapy program, we help you get back to your normal activities of daily living, and we also help you get back to things that you want to do throughout your general day. So therapy goes a long ways. We can cover a variety of things, and we're here for the public, like we said, to help out with the rehab.
And not just older people. I mean, there's
Not at all.
all kinds of people that have to have surgeries and so you can help all these people, and you have 12 locations to do so.
You're absolutely correct. We have 12 locations around Louisiana, and a wide variety of conditions we can cover. So check with your physician. If he feels that you can benefit from home health therapy, we're more than willing to serve the public and help them out in any way we can. And like you said, you want to prevent falls. We want to prevent all these things in the home, and these are all really big and really important as far as home health care goes.
Okay, real quickly, again, who out there can you help?
We can help the geriatric population. We can help patients who's had surgery. We can help patients, speech patients, also people who have occupational injuries. So we can serve a wide variety of people. If you have any questions, you can contact the number on the screen for Home Health Care 2000, and we'll be more than willing to help you with our therapy program.
And you have the 12 locations. So Dr. Wayne Campbell is here for you guys. You can call him today at Home Health Care 2000, 439-5444. Call them today. We are here today with Home Health Care 2000. I'm Anne Marie, and we're here with Stephanie Morris. Good morning, Stephanie.
Good morning, Anne.
Now, you know, Home Health Care 2000 has been here almost 20 years serving the community. Why don't you tell the viewers out there, you know, who can you help?
We can help the community with their home health needs. If someone has had their post-op after surgery, we're there. You're going into the hospital, you're coming out of the hospitals quicker, and you still have some deficits. And so those are the things that after a surgery, if you've been newly diagnosed with a specific disease process and you need more education and more assistance at home, we can come and do the home health evaluation. Ask your doctor, be informed. Ask your doctor, do I need home health? Sometimes the doctors have their plan of care. We work under the auspices of the plan of care from the physician, but we, as the patient, we have to be proactive, and we have to ask our doctors, am I a candidate for home health? I want more education on this. And so what happens, you get your evaluation, we come in, the nurses go in, and we communicate with your physician. We work the plan of care specific to your disease process.
Okay, for those out there that are not sure about payer sources, tell us how it gets paid for.
It's like this: Medicare, Medicaid, private insurance, workman's comp, Veterans Administration, and of course, private pay, however
Right.
you want to do that. And a lot of times people want to know home health. If you're on home health and you're using your payer source Medicare, there has to be a status of homebound. And
Right.
how we define homebound, if it takes a taxing effort to leave the home. If it's your private insurance, of course, we take a large selection of payer sources. That's one of the advantages of using home health, because we are on with a lot of providers, and our providers list is very broad. Our
Great.
locations span throughout the state of Louisiana. We're in 12 locations. We're north through Alexandria, east through New Orleans, and here west to the I-10 area, and then down into the Cameron Parish. So we can service a lot. And sometimes most of the times with my orthopedic surgeons, they want to know, wow, your service area is so broad, and you have a large list of insurance carriers, and that's a plus for the community when they go in and they have the different insurances. We're the home health of choice when it comes down to that.
Okay, real quickly, tell the viewers out there, when should you call Home Health Care 2000?
When you have concerns and questions, when you're knowing you're going in for surgery, if you have your aging parents and they've been diagnosed with a new diagnosis and they're talking and they're not getting better and maybe there's
Right.
some deficits going on, maybe we need to get a home health evaluation so we can bring our team in, work with the physician so that we can get that patient to a state of wellness that's most desirable.
Okay, that's great. Call Home Health Care 2000 439 5444.